Today, the city of Amarillo and public health officials announced a student at Fannin has an active case of tuberculosis and that they would test some classmates. Tuberculosis is a bacteria that usually attacks the lungs, and if not treated properly, TB can be fatal. Marissa Lucero looked into the disease and is here with more. Marissa?
Larry, officials at the public health department say infection is most likely to occur if you're exposed to someone with TB on a day-to-day basis. And students at Fannin Middle School are with each other 5 days a week and at least 6 to 7 hours each day.
The one confirmed case of TB at Fannin Middle School has parents of students concerned and some of them angry. And although officials are treating this active case by CDC guidelines, they say it's not an emergency.
TB is a serious condition and it's a serious illness. It's not an emergency. This didn't affect the entire school.
Director of Public Health Department Dr. Richardson says TB is spread through the air like coughs and sneezes. And as a result, 2 TB-related conditions exist, latent and active.
And what we want to do in this case, we're hoping to identify anyone who might be in the latent stage, because there's a very effective treatment for that.
The Public Health Department will administer skin tests to nearly 130 students to determine if any tests positive. Additional testing would then take place, and if need be, medication.
Treatment for active TB is the same as a latent TB, and so people that have a positive skin test can just be exposed to TB and be a carrier, but they're not infectious. They get an antibiotic therapy for several months to just eliminate it from their body.
Active TB persons will take 4 different antibiotics, which Richardson says the department doesn't expect to see any additional active cases.
We are looking at classmates and faculty of that case to make sure that we test the people who could have been exposed, even though the probability or the likelihood of infection is very, very low.
Richardson says there's not a vaccine approved here in the United States for TB. Therefore, children are not required to have it. Larry, back to you.
All right, thanks, Marissa.